Hello, my name is Joanna and I'm a physio in Roma. I'm going to talk to you today about lateral ankle instability taping. The aim of this video is to demonstrate basic ankle strapping for the prevention of lateral ankle sprains. Hertel in 2002 discusses that lateral ankle sprains are one of the most common sporting injuries. Lateral ankle sprains usually occur when there is excessive supination of the rear foot on an externally rotated lower leg. The ligaments most commonly affected are the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneofibular ligament. Mikkel et al., Kelmer et al., and Sherman et al. All discussed that prophylactic ankle taping has long been considered the mainstay of ankle injury prevention and is used widely today. A critical review by Verheyen and his colleagues showed that taping does reduce both the incidence as well as the severity of ankle sprains. The equipment that you will require includes alcohol wipes for cleaning the skin, Hyperfix or Fixamol, rigid tape, and a pair of scissors.
Okay, so once you have your patient positioned on the bed to strap the ankle, we want to get them up in 90 degrees, so you have a nice 90-degree bend through here. If they've got particularly oily skin or they have moisturised their skin that morning using just a little alcohol wipe, you can just wipe over the skin, cleaning off anything that will stick between the skin and the tape, which will make your taping less effective. I'll just allow that to dry. Underneath your rigid tape, which is your brown or white tape, it can be quite irritating to the skin, so we use either Fixamol or Hyperfix, and we're going to cut lengths of that just to help protect the skin. So to measure up how much of that you need, you can just wrap it around the patient's ankle and then cut that off. Trying to make sure that as you wrap that around your patient's upper ankle area, it's just above your Achilles tendon and that there's as fewer wrinkles as possible through that. You then want to do layers for your stirrups as well. So that, again, measuring up from inside to outside, and you'll want 3 of these. So when positioning on your Hyperfix or your Fixamol for your stirrups, if you just start with peeling back the start of the tape, because these are quite long strips, the first one you want to position just posterior, over the posterior third of the lateral malleolus. Wrapping around the base of the foot to come just posterior to the medial malleolus on the inside and back onto your initial lock that you've got there. Depending on the size of your patient, you may need 3, or if you have a small ankle like we have today, you may only need 2. So this one probably only needs 2, because we can cover over our malleolus quite nicely with the 2 strips. And that one will come just over the inside of the medial malleolus. If you have over guesstimated, you can trim off with a pair of scissors. So we are going to be doing a couple of strips across the front of the ankle here as well. So we're just going to put a couple of small strips of Fixamol across the front of the ankle. Again, we just don't want to get irritation from the rigid tape. then taking your rigid tape, we measure again for three stirrups. So if you unroll your tape, you can then flip it over so it's on the non-sticky side, and you can measure up how much you will need and tear off your tape. So again, because we're doing for a lateral ankle sprain, we're going from the outside. So we attach to the top of the anchor that we had earlier, just here. Again, just towards the posterior third of the lateral malleolus. At this point, you may want to just remind your patient to bring their foot back up to that 90 degrees, laying down firmly and wrapping around to the other side. And then just rubbing that to make sure that it sticks. Stirrup number 2. So when you do your stirrups, unlike your fix them all, you want a little bit more overlap. So you want to overlap about a third to a half of your tape. So again, sticking down, just make sure that position is quite nice at that 90 degrees. Thank you, patient, you've done a beautiful job there. And then sticking down on the other side. And your final stirrup. Again, coming 1/3 in front, wrapping around the base of the foot and coming up to the other side. Just making sure that is all nicely adhered. Next, we want to do a 6, which is a small coming down the inside and around to pull the foot in, because we want to lock out and stop that ankle from rolling laterally. So again, usually a measure of your stirrups gives you a good idea of how much tape you'll need. So we're going to do a 6 in each direction. So we're going to start with on the inside, coming down to the arch of the foot, coming around and wrapping over so that you make a number 6. We're going to do the same. This time starting on the outside, so we want to come down the middle of the malleolus, just through here, wrapping it around the base of the foot and coming over the top. Just a little bit of curling happening there. There we go. Again, trying to make sure you don't get too many wrinkles. Now that wasn't the best piece of tape because we have a small little area here that is open and exposed, that if we did sprain our ankle or we got any swelling in the foot, could cause some issue to the skin underlying. So when that happens, just get a small amount of tape to go over the top of that and cover it so that skin isn't able to push out. The last part of doing an ankle taping is to do a heel lock. So again, you'll need quite a bit of tape. Usually keep the tape on the roll if you can, because you may need more than you initially think. So starting at the lateral malleolus, we wrap around, come under the foot, wrap around the back of the heel, just here. You might have to let your tape go there so that you can get a nice smooth line and switch your hand placement. Come back over, and just twist it a little bit there, a little bit more length of tape. You all right there? Mm-hmm. Yep, all good. Okay. And coming over the top. A nice neat pattern. And you can again just tear off that excess so that it sits nicely back on the skin. And give that a quick press just to make sure everything is adhered. So then we're doing the same going in the other direction. So we're starting at the medial malleolus. So on the inside, wrapping around to to do your second ankle or your second heel lock. Coming around, up, and finishing on the side there. Have a quick look at your ankle. Check there's no little bits of skin anywhere. So we have got a little one just at the top here, which we're going to cover up. Check that you've got nothing behind, that it all looks neat and tidy. Good. And then just to lock off, just a single strand of your rigid tape. Again, measuring that one off. And we don't want any tension on this last piece of tape. So we're just going around just above the top of the Achilles there, just to lock that off. And that is your basic ankle strapping.